In this video, you will learn about the procedural steps for performing IV drug administration, including the equipment required. This is an NHS Highland Practice Development Skills video adapted for UHI use. This video is designed to be used by student nurses in conjunction with a practical teaching session and directed reading. It can also be used as a reusable learning unit to refresh your knowledge and skills. UHI skills training attendance and competency assessment must be completed before performing this skill, and students should make themselves familiar with the relevant NHS Highland skills policy, which can be found in the policies library on the NHS intranet site. Before approaching the patient, perform hand hygiene, introduce yourself to the patient, explain the procedure including risks and benefits, gain verbal consent and check allergy status.
Equipment required. Medicine's prescription chart, the medication, your reconstitution fluid, pre-filled saline flush. If not using your pre-filled flush, you will need a 10ml syringe, a saline ampule, and a needle for drawing up. You'll also need a red blunt filter needle, a red sterile Luer lock cap, PPE including gloves and an apron, a wipeable tray for ANTT. This can be any wipeable tray or surface, but not a cardboard tray. A sharp spin, Clinell wipes, Luer lock syringes of appropriate sizes, and if using an infusion, your yellow drug additive labels. Visually inspect the vascular access device for patency, signs of infiltration, infection or phlebitis. Disinfect tray and allow to dry. Assemble equipment using aseptic non-touch technique, ensuring not to touch key parts and keeping them covered with either a red sterile Luer lock cap or the item's packaging. Check medicine, reconstitution agent, flush, prescription and drug calculation. Perform hand hygiene. Clean the top of the vials or ampules as well as the diluent with Clinell wipe for 15 seconds and allow to dry. For infusions, also scrub the port of the infusion bag. Using aseptic non-touch technique, prepare the medicine as per Medusa monograph and prescription chart. When reconstituting the medication and injecting the diluent into the vial, this will cause pressure within the vial. To release the pressure, ensure the tip of the needle is in the air pocket within the vial and allow the air to transfer into the syringe. With the needle still in place, reconstitute the medication as directed in the IV Medusa guidelines. To then extract the reconstituted medication from the vial, invert the vial, keeping the needle in the solution, slowly depress the plunger to push the air into the vial. Then release the plunger so that the solution flows back into the syringe. Inspect the solution for cloudiness or particles and remove any air from the syringe. Apply non-sterile gloves. Scrub the hub of the needle-free access device for at least 15 seconds using a Clinell wipe and allow to dry. To prevent contamination of the hub, you must continue to hold the end of the line firmly throughout the procedure. Using ANTT, attach syringe with flushing solution to the needle-free access device. Unclamp if required. Flush the vascular access device with 5 mL using a push-pause technique, which allows for a turbulent flush. Maintain positive pressure at the end of the flush. Reapply clamp and disconnect the syringe. Using ANTT, attach the syringe containing medication, unclamp the lumen if required, and administer the medicine at a rate in accordance with the IV medicine monograph. Frequently check for flashback throughout the bolus injection every 3 to 5 mL. If the patient complains of discomfort or shows signs of reaction, discontinue and call for help. Reapply clamp and disconnect syringe. Administer a further 5 mL of flushing solution using a push-pause technique and ending on a positive pressure flush. Scrub the hub of the needle-free access device for 15 seconds using a Clinell wipe and allow to dry. If multiple bolus administrations are being given, repeat the process with an additional flush between each medicine administration to prevent compatibility issues and administer a final flush at the end. If administering an infusion, reconstitute the medication as previously shown and as per Medusa guidelines using ANTT. Then open the fluid bag and clean the injection port with a 2% chlorhexidine and 70% alcohol wipe for 15 seconds and allow to dry. Inject the drug into the injection port of the fluid bag using a new sterile red blunt filter needle and ANTT. Invert the bag a number of times to prevent layering. Complete the yellow drug additive label and attach to the back of the fluid bag. Attach and prime the giving set. Inspect the solution for cloudiness. For administering a flush after an infusion that is a fixed dose, to ensure full prescribed dose is administered, follow the manufacturer's guidance around volume of the giving set, which is usually around 20 mL, and flush the giving set with the compatible solution at the same rate the medication was infused. If administering a flush after an infusion that was at a variable rate, discard the infusion set and flush the cannula at the same rate the medicine infusion was administered in order to avoid the bolus effect. Remove PPE and discard waste. perform hand hygiene, and then document medicine administration on electronic or paper prescription chart. Please ensure that appropriate PPE is worn when carrying out all clinical skills, including aprons. Aprons have not been worn during the making of these skills videos to reduce noise interference.